Lumbar stenosis is one of the most common conditions, and many patients, especially the elderly, suffer from this condition. Understanding this condition is important in empowering you to make the right decision for your situation. I am a minimally invasive spine surgeon who takes care of this condition on a routine basis. By the end of this video, my goal for you is to understand what lumbar stenosis means, why it causes symptoms, and how to think clearly about your options. Let's start with the big picture. Your spine has natural open spaces that allow the spinal cord and the nerves to travel freely. Lumbar stenosis means those natural spaces have become narrower. Lumbar stenosis specifically refers to this condition in the lower back. In the majority of cases, the narrowing happens slowly over time. Disc bulges, overgrown ligaments, or bone spurs from arthritis can gradually crowd the nerves. When nerves don't have enough room, they don't function very well, and that's when patients start having symptoms. Common symptoms include leg or back pain, numbness, leg heaviness, and in some cases, weakness. In some cases, patients notice symptoms get worse with standing or walking and improves while sitting or leaning forward. Pain is not always present. Patients often ask me, if my MRI says severe stenosis, does that mean I need surgery? Not necessarily. Imaging studies show structure, not how your body is actually functioning. Treatment decisions are based on symptoms and limitations and progression, not how the MRI looks. Another common question is walking bad for stenosis? Movement is important, and although patients with stenosis may have trouble tolerating prolonged walking, we highly encourage moving. Just remember, difficulty walking should be a good reason for you to seek out a specialist to help you evaluate your back. And then there's a question people hesitate to ask. What happens if I ignore it? Many patients have narrowing of the space around the nerves for years without having any symptoms at all. The onset of symptoms signal worsening of this condition and the fact that the nerves are no longer functioning properly. In this situation, I recommend seeking out a trusted spine specialist to develop a better understanding of your situation. Patients often ask me, what are the symptoms that should make me see a specialist right away? The ideal situation involves seeking out care as soon as you start experiencing symptoms and not waiting for things to get worse. In some cases, the narrowing of the nerve can lead to a spine surgery emergency called cauda equina syndrome. With this condition, patients experience significant leg weakness, difficulty walking, and can even experience loss of bowel or bladder function. Failure to seek care immediately in this instance can lead to permanent neurological damage. If you are experiencing any of these symptoms, you need to go to the nearest emergency room immediately. As I previously mentioned, it is best to seek help early so things don't get to that point. What is the role of surgery in patients with symptomatic lumbar stenosis? Generally, we start with medications, physical therapy, and monitor the patient's progress. Spine injections can be used to control pain, but they do not provide long-term benefits. For patients with persistent symptoms, surgery is the only treatment capable of offering long-term benefit. The goal of surgery in these patients is to remove the offending pathology and create more room for the nerves. Is there a role for minimally invasive surgery in treating patients with lumbar stenosis? Absolutely. The most common surgery performed to treat lumbar stenosis is called a laminectomy. This involves unroofing the bone, covering the nerve, and removing overgrown ligaments and bone spurs. Typical surgery for this involves cutting through large muscles in the back to perform the surgery. With minimally invasive techniques, using small tubes and super specialized cameras, we can avoid cutting back muscles, avoid collateral damage, while still creating room for the nerves. I highly recommend seeking out a spine surgeon specifically well-versed in these advanced techniques. With proper treatments, patients with lumbar stenosis can get their lives back and return to doing what they love the most. Good spine care isn't about rushing into surgery or avoiding surgery altogether. It is about choosing the right option at the right time for the right reasons. If this helped bring clarity, that is exactly the understanding I want patients to have before making decisions about their spine. If you want more videos like this, where I explain spine conditions and treatments in a way that actually makes sense, hit the like button and subscribe so you don't miss the next one.